Yeah, there's a lot that has been presented at this year's meeting regarding chronic lymphocytic leukemia. I would say we've had several notable presentations. One that caught my attention was in demonstrating that patients who fail or progress on tyrosine kinase inhibitors, such as ibrutinib and idelalisib, they actually do have responses that are notable with the anti-BCL2 agent venetoclax. So again, this was presented originally last year, and there was an update on that at this meeting where patients who had previously received ibrutinib had close to 70% overall response when they received venetoclax, and patients who received idelalisib previously had close to 50% overall response rate with venetoclax. There was also another oral presentation excuse me, on patients who received chemoimmunotherapy but had less than adequate response. So they had a partial response, or they had minimal residual disease positivity, or maybe negativity but with some risk factors such as deletion 17. And these patients were randomized to receiving lenalidomide as a maintenance therapy or placebo. And maintenance lenalidomide improved progression-free survival in these patients compared to placebo. There was a presentation also on the combination of idelalisib plus chemoimmunotherapy, bendamustine, and rituximab. And this presentation showed improvement over chemoimmunotherapy by itself, so really showing that we can combine these agents with chemotherapy. And I'll finish by mentioning an abstract that was published by the Ohio State group looking at using acalabrutinib after ibrutinib failure or intolerance, and there were pretty impressive responses with this agent, suggesting that you could use this new BTK inhibitor after failing or not tolerating the older one, which was pretty interesting. So a lot of interesting and exciting stuff at this meeting.